here with CARYN Duncan, one of the workers and facilitators of the first ever women's only pharmacy in the downtown east side. It's the first ever here in North America. And one of the services they'll be offering here is the Methadone program. And in general in this neighborhood, there's some problems with some of the clinics that offer the Methadone services. And I just wanted to ask her a few pointed questions, some of them uncomfortable in my opinion, but she's here and willing, and hopefully she won't throw us out.
No, I never do that. I'm always willing to have a conversation with folks, always.
In the very beginning of the Methadone program, it was instituted as a taper program. For the most part, and from what I've seen and understood through a lot of friends and colleagues who've been on the program, there no longer seems to be a tapering program. As a matter of fact, it's the exact opposite. The people who frequent a lot of the pharmacies seem to be not getting the effect of the methadone, and they're having their dosages raised rather than lowered. How do you feel about that from your perspective?
Well, I must admit, I don't know a lot about the details of people's personal lives and their care. And we do respect the decisions that women make about their health care around all sorts of meds. So, I can't really comment on that. I think that we want women to live healthy lives, and maintaining and managing addictions is an important part of that, and methadone can be a tool to doing that, and that is why we decided to offer methadone at our pharmacy, along with many other, a full range of prescriptions.
Of course. In this neighborhood, there's been some problems with kickbacks, and you advocate that you will not be taking kickbacks, and because you're going to be a full-service pharmacy rather than just a methadone dispensary, you will be able to offer more for women in this neighborhood rather than just a cup of juice, a cup of coffee, and we'll see you later, and hand out money like some of these other places do. There's some fairly controversial stories that have come out, and obviously not so much myself, but people will be keeping an eye on this place to see if you live up to your name, and I don't believe that there will be any problem with that. But you agree there has been some problems with pharmacies in general?
Well, I certainly, like other people, have read the newspaper stories about this and heard it on the radio and the TV, and it was widely reported last year. And I think the college did take steps to try and address some of these problems. I'm sure further work needs to be done. We are a community organization. We will be operating a very respectful, law-abiding pharmacy, conforming with all the rules and regulations, including those outlined in the college by the College of Pharmacists, and that is how we've always operated and how we will function as a pharmacy as well.
Okay, a couple more good questions for you, CARYN. How do you feel about clients that are doing heroin and still being prescribed methadone?
Well, I don't know how I know about that, or we'd know about that, because we don't ask we don't ask about the intimate details of people's lives. So if a woman comes in with a prescription and wants it filled, the pharmacist is going to be engaged in supporting her and hopefully supporting her to make good choices about her health. We support women. It isn't our role to to investigate or cross-examine. We're here to help women, and so I don't know how I would know that, and we wouldn't ask those questions, and we wouldn't single out a certain a woman with a certain health care issue and treat her differently than any other woman. We treat everybody the same. We're about treating people with respect and treating people as equals.
Of course. The question was, though, not so much as the clinic, but as people who do heroin and methadone at the same time is potentially a higher risk for an overdose. If somebody gets their methadone and they've done heroin, it could increase overdose.
Yeah, and again, I don't know enough about the medical side of methadone, but what I can tell you is that we encourage all women to live healthy or healthier lives, and taking and risk-taking behaviors regardless of what they are, including drinking and driving, are not good behaviors, and we would encourage women to live healthier lives, and this is a part of that. But we don't single out certain types of women with certain types of health issues and focus on them, and we are not, you know, police. We're not the healthcare police here.
Do you believe methadone is addictive?
I don't know that. I think that's better asked of a doctor. I think that methadone is a drug, and it's a drug that's dispensed legally within British Columbia under the Medical Services Plan, and it's a drug that we will dispense here.
Okay. How do you feel about the health effects of long-term usage of methadone? Somebody who's been doing it for 10.
And what are the health effects?
I was hoping you might have an opinion on that.
Well, I don't know what they are, though, so I can't really have an opinion.
Well,
I'm not a doctor, and I don't have that kind of intimate knowledge, which I think you have, and so I don't, you know, I don't have a medical background, right? I'm a leader of women and an administrator, and
you probably will now get hands-on exposure to people who've had long-term, exposure to methadone. You probably will get exposed to people who do both methadone and heroin, and you just might get people overdosing in your clinic. How would you feel about that?
Yeah, I'm not sure. Well, obviously that would not be a healthy environment for a woman to be in.
It does happen in other clinics, and it happens.
Yeah, and we'll deal with it if we need to. We have an emergency service, like, you know, an ambulance, and we'll call the ambulance. But we've set up this space to celebrate women and honor women, and if women are in crisis, then we will try and support them. I don't operate under the premise that we're going to have, you know, adverse things happening, because that's not the way I do my work. I need to be inspired to do my work, and that means remaining positive and realistic about what we do. Yeah.
Thank you very much for your time.
Thank you. I appreciate that. Okay. Thank you.